Hi, my name's Daniela and I'm one of the doctors working within the respiratory department at the Royal Derby Hospital. This short video will help to explain more about the condition obstructive sleep apnea and some of the treatment options available, in particular continuous positive airways pressure, or CPAP for short. So what is obstructive sleep apnea? Obstructive sleep apnea, or OSA, is a condition where the upper part of the air passage, behind the tongue, collapses, and this tends to happen at night when your muscles are more relaxed. This means that air cannot get into the lungs, which causes the oxygen levels in the blood to fall. This is detected by your brain, which briefly rouses you from sleep to reopen your air passage. This is often not enough to wake you from sleep entirely, but you may choke, snort, or gasp. This can happen several times an hour, leading to a poor night's sleep. These changes can be worse in certain positions, such as lying on your back. Other factors, such as having a large neck circumference, being overweight, smoking, or having an airway abnormality can also make you more likely to suffer from OSA. Snoring is caused by air vibrating through a narrowed air passage, and this is often, but not always, associated with obstructive sleep apnea. What are the complications of having OSA? The repeated awakenings in OSA mean that you can't have a restorative night's sleep, and you may find that you are drowsy in the day. This can put you at an increased risk of accidents at work or on the road. You may also experience symptoms such as morning headaches, poor concentration, and irritability. It can also cause you to wake frequently in the night to use the toilet and impact on your libido. If left untreated, OSA increases your risk of heart disease, high blood pressure, atrial fibrillation, which is an irregular heart rhythm, stroke, and diabetes. It can also result in a very sleep-deprived partner. How is OSA diagnosed? OSA is diagnosed via a test called sleep studies, with equipment that monitors your oxygen levels and heart rate overnight, and sometimes also arm and leg movements and the muscles of breathing. How can OSA be treated? The first stage in managing OSA is often lifestyle measures, including maintaining a healthy weight, stopping smoking, and improving sleep hygiene. This involves ensuring that you get an adequate quantity of sleep, as well as avoiding the use of electronic devices immediately prior to bed, and minimising consumption of alcohol or sedating medications. If sleep apnea is severe or persists despite these measures, then it may require additional treatment with continuous positive airways pressure, or CPAP. What is CPAP? CPAP provides a small amount of steady air pressure to hold the airways open and stop them from collapsing. You sleep with a close-fitting mask over your nose or nose and mouth, and this is connected to a machine via some tubing. By keeping the airways open during the night, your sleep won't be disrupted, and this will also stop you from snoring. It is important to say that this is not a cure for obstructive sleep apnea, but will help to manage the condition and prevent complications. Successful treatment of OSA has also been shown to reduce the risk of complications in elective surgical procedures, and so your anaesthetist may recommend treatment prior to surgery. Are there any side effects to having CPAP? Sometimes the mask can rub against the skin, particularly on the bridge of the nose, leading to small sores. It is important that the mask fits snugly to avoid a leak of air, which can be noisy and reduce the efficacy of the machine. Often this problem can be solved by trialling different types of masks and amending the mask fit. Air may leak out of your mouth if it falls open during sleep. If this happens, we might advise changing your sleep position or use of a chin strap to hold your mouth closed. The air that is being instilled through the mask can sometimes dry out the mucous membranes of your nose and throat, and so we may add humidification, which gives warmth and moisture to the air. If you have a blocked nose, then you may need treatment with a nasal spray, but if this is as a result of having a cold and you can't use the machine for a few days, then this isn't going to cause you any harm. When starting on CPAP, some people can find the mask claustrophobic, but often you can get used to it, particularly once you've had the benefit of an improved night's sleep. OSA and driving. We now know that OSA can lead to excessive daytime sleepiness and poor concentration, and this can put you at an increased risk of accidents when driving. If you are diagnosed with OSA and have symptoms of excessive daytime sleepiness when driving, you may need to inform the DVLA. If you are unsure about this, then please ask a medical professional for advice or refer to the DVLA website. If you have symptoms when driving, then you should not do so until you are informed that it is safe, and this will often be once you have been successfully commenced on CPAP.